Welcome to the Myrna Method.
Hold on. Wasn't there.
Okay.
Now you're
Okay. Welcome to the Myrna Method live stream. I'm registered dietitian Myrna Haag. My goal is to bring you impactful nutrition information that can change your life, because that's exactly what impactful nutrition can do. In this video, we're going to talk about the hidden dangers behind dietary fat. Now, I know a lot of people are pushing the sugar deal, sugar being the big villain, but honestly, it's understanding how to get the 4 macronutrients, protein, fiber, carbs, and fat, balanced correctly in the right ratios, not just for the day, but for your meals. And when you don't get this right, you get massive mayhem. And this is what I don't think people really understand in nutrition. So in this video, we're going to take a deep dive into dietary fat. I'm really going to explain how this one macronutrient, not properly eaten correctly in your diet, and it's not just eating types of fats, but literally the macronutrient fat, too much of it, can cause type 2 diabetes. So let's really dive into it and show you the science on how this works. So the hidden danger behind dietary fat, and really it's a little caveat here. Dietary fat is actually good for you, right? The right amount of fat, the right kind of fat. All our cells are surrounded by fat. The brain needs fat. I get it. Fat is an essential macronutrient, just like all of them are essential. But the key with nutrition is we're not understanding that there's a correct way to eat. And just because you're losing weight doesn't mean you're solving anything. Okay, I'm going to say you lose some pounds, you're going to be a little healthier. But if you don't do it the right way, all you're doing is getting a good set of labs temporarily, kicking the can down the road. Because I want to show you the science, what happens when these 4 macronutrients, protein, fiber, carbohydrates, and fat, are not properly balanced in the diet. And what we're going to talk about in this video is fat. And we're going to pretty much explain how when this macronutrient is not properly eaten, it actually is the cause of many of our metabolic diseases, which are obesity, type 2 diabetes, dementia, which is type 3 diabetes, Alzheimer's, cardiovascular disease. These are diseases that are 100% preventable. They don't need to happen. And they're dietary caused. So first of all, a little caveat, I always talk about what's the difference between eating healthy and balanced. Eating healthy is just eating foods that have healthy ingredients, like fruits healthy, avocados are healthy, certain foods that have a lot of good nutrients in them, they're all healthy. But balanced is a little different. A lot of people don't understand that. When you eat balanced, we're referring to, in my practice, when I'm helping patients eat right, I'm referring to the dietary chemical homeostasis from eating the correct ratio of protein, fiber, carbs, and fat. There is a correct, proper ratio. And when this ratio is off, which I'm going to show you in this video, in relationship to fat, you're in big trouble. So let's go real simple into the root cause of type 2 diabetes and also type 3 diabetes, which is Alzheimer's, right? But excess fatty acids are the root cause. Now, sugar is implicated, and insulin is also, they're players. But when we're really looking as to what causes the disease, it's excess fatty acids in circulation, in the blood. This causes type 2 diabetes and insulin resistance. And what's insulin resistance? It's type 2 diabetes a decade before. So what is going on? Real simple is these dietary or these excess fatty acids, I'm going to tell you where they come from next. They literally clog up the receptor site that the hormone insulin attaches to. And when that receptor site becomes clogged up with too many excess fatty acids, then this is what the root cause of insulin resistance type 2 diabetes. So fatty acids clog up the insulin receptor site in our cells, primarily muscle cells, causing the muscle cell to not do as well in metabolizing sugar. And also, The muscle cell doesn't do well in synthesizing proteins. So when you have insulin resistance or type 2 diabetes, your muscles are not functioning as well as they should. And your metabolism gets affected as well, which I've talked in other podcasts how that happens. So where do fatty acids come from? Number one, eating excess dietary fat. And the big word there is excess, right? Because a certain amount of fat is needed. But when you're doing in excess, and in the latter part of this video, I'm going to tell you the exact amount you need. So stay tuned because we're going to tell you how to fix it. Second is having excess body fat itself that releases fatty acids. So maybe you're eating a low-fat diet and you're eating a lot of carbs and you're just getting fatter. So the actual fat cells themselves release fatty acids in excess, which that kind of makes sense. And then number three, the one area that a lot of people may not realize is fat cells that release fatty acids. And this is not when you're losing weight. So when you're losing weight, it's kind of a double sword here. You're losing a lot of weight, so you're actually decreasing the number of fat cells. So you're going to have less fat cells released because you're actually losing fat. I'm talking about people that do prolonged fasting. They're on high-fat diets. They're doing keto diets. They're maybe super lean, and I'm going to give you some patient examples. But I think this is an area that people are really misinformed because they truly believe if they eat a diet high in fat, they're going to be better off because they're so convinced the carbs are the big problem. And we're going to go through some blood work of some of my patients, and I'm going to show you the implications in this and why this can be a real problem with type 2 diabetes, cognitive decline. So let's do the easy stuff first. Eating excess dietary fat. Now, like I said, a certain amount of fat and a certain type of fat, the omega-3 fats, super, super important for the brain health, cellular balance. Yes, we need good fats. But when you eat an excess of dietary fat, and I'm talking about even the good ones, even the plant-based, the avocados, the seed oils. When you're just eating in excess, you release an excess fatty acids in circulation. So eating excess dietary fat leads to excess fatty acids in circulation. Number two, the second culprit is excess body fat. So body fat, as it becomes enlarged because you're just too fat, begins to release fatty acids. That's just kind of what fat cells do. So fat cells have this way that they perform, and one way is when they get really large, they begin to release the little fatty acids into the blood. And this is an excess of fatty acids in the blood. So you're eating too much of it, or you have too much body weight in fat. So even if you're eating a low-fat diet, it's an excess. And then the other one I really want to dive into, and I can give you some examples of some patients that I've treated in this scenario, and I'm going to show you some of their lab work so you can see, is forcing the excess release of fatty acids from fat cells without necessarily weight loss. And these are people that are misinformed. And they believe that if they do, a lot of healthy fats, a lot of nuts and avocados, and they're doing the seed oils, the olive oils, and some of these are very healthy, but they're not eating the macronutrients, protein, fiber, carbs, and fat, in the right ratios. And this is causing huge mayhem. Now, here's what happens. They drop their body fat percentage low, and they're so excited to tell me. I had one woman, she's literally marathon runner, and her body fat's down around 10%. Anything under 13% for women, I always have to raise a red flag. Because this can mean that they are purposely not eating enough carbs to fuel their exercise. Because they really believe, and the blood work does show, they really believe that if they can pull fat from the fat cells, that they will actually have a lower body fat, and this is a good thing. Well, yes, if you are constantly pulling fat from the fat cells, you can have a scenario of a low body fat, but what you're doing is you're not in a balanced situation. You are releasing a lot of excess fatty acids in circulation, and this can be a culprit for type 2 diabetes. So for a lot of people, they're thinking, wow, this is the first time I've seen this. Well, I have patients I'm treating with this scenario. So a lot of what I'm pulling from is patient data. And I've had patients come in that are athletes that they're eating some carbs, but they're fueling a lot of their sports with these healthy fats. And they're super excited because they are under the notion that this is going to make them even leaner. And I'm not debating that it probably is, but possibly at the expense of making them sicker, contributing to type 2 diabetes, dementia. Now, not initially. This is when I see it with some of my older patients in their 60s who come to me and they're so confused because they're athletes. They've had great eating habits. They don't eat any sugar. They tell me all the time, I don't eat any sugar. And yet they're getting prediabetes and they're lean. So the release of excess fatty acids come from fat cells. And I think the thing I'm really trying to drive home here is it can come from fat cells because you're just too fat, and that's just what fat cells do. Or because you're really forcing a diet to do a lot of beta oxidation, to really use fat for the main fuel, because there's just not a lot of carbohydrates to fuel your activity. And yeah, your body will begin to pull a lot of fats from the fat cells. So, where do all these fatty acids go? Well, first of all, I have to keep going back to the idea that, wait a minute, fats do a lot of good things. So when fatty acids are in circulation, the body directs them to different destinations, to the heart, to the liver, to the brain, to the muscles, to all the cells in the body. In fact, all our cellular membranes are made from fat. And the type of fats matter. We're not going to talk about that in this video, but yeah, the omega-3 fats, super important. The brain, getting enough fat for the brain. But understanding that there is a certain amount that's actually healthy. So just because the brain needs a certain amount of fat doesn't mean you should be eating a high-fat diet. Now, what can happen with an excess amount is it can actually clog up these receptor sites, and this does not allow the transporter to the surface of the membrane of the cell to allow the sugar in. So the point I'm trying to make here is that, yeah, fatty acids in circulation have a lot of positive benefits, but they can also, not properly balanced, be a huge culprit for a lot of negative problems. So what we're looking at here is a situation where the type 2 diabetes starts out as insulin resistant. Some of these receptor sites get clogged in these muscle cells. Now the muscle cells are taking in all these fatty acids from the fat cells that are releasing them, maybe too much dietary fat, and the transporter that allows the sugar doesn't come to the surface. But one thing I want you to notice different in this slide that I didn't have in the other slide is these fats that accumulate in the muscle cells because of too much excess fatty acids that are in circulation, they change into a type of fat called a ceramide. So the ceramides are just a biochemical process that happens when fatty acids are accumulating too much in places they shouldn't, such as muscle cells. Now, muscle cells are designed to have some fats in them, but when it's in excess, and that's the big word here, when it's in excess fats accumulating in muscles, this is the root cause of insulin resistance, which then leads to type 2 diabetes. And this is called, when this is starting to happen, excess fatty acid, it's called lipid, which is just a fancy word for fat, lipid toxicity. When there are more fatty acids than the body needs, then they're stored in fat cells. Okay, that happens. They're also going to the plasma. But any nutrient in excess, and I really want to make this a point, anytime you eat in excess of too much food, you're just eating too much. This will end up as body fat, which will then be releasing these fatty acids. This is all called lipid toxicity. It's when you have a fatty acid overload. And this oversupply of fatty acids clog up the insulin receptor sites. This is what disrupts the metabolism. It actually fuels chronic illness. And we're going to talk about that next. So the too much dietary fat, this lipid toxicity coming from too much body fat, too much releasing of these fatty acids from these fat cells. I'm talking about healthy fats just in excess. And what happens is when this receptor site for insulin is disabled because there's just too much fat up in there, and these fats differentiate into a type of fat called a ceramide. These ceramides can actually also circulate in the plasma in the blood. But what happens here biochemically is the transporter that normally comes to the surface and allows glucose into the muscle cell, well, when it's all clogged up with fat in the receptor site that insulin tells it to do that, well, the message never gets there. Then you have an excess of sugar in the blood, and where that sugar tends to go, you guessed it, into the fat cell. And as the sugar that was meant to go in a muscle begins to pile up in the blood, you're going to also have elevated blood sugar, you're going to have elevated insulin, but the root cause are the receptor sites that are clogged up because of too much fat. And not understanding that the macronutrients, protein, fiber, carbs, and fat, need to be eaten in their correct amounts for very good reasons. So this lipid toxicity is the root cause of type 2 diabetes. And it happens three ways. Excess stored body fat that continually breaks down and releases fatty acids into circulation, overwhelming the system. A high-fat diet, which again oversupplies the system, even if it's plant fats and healthy fats, oversupplies the key word. Or a lifestyle that induces the release of these fats from fat cells because people are misinformed and they just believe, well, I'm just going to be eating all fat so I can just have my body be a big fat burner. That's not how muscles work. And I have a lot of podcasts that I talk about how muscles work because muscles are tied into your health. So, a key point is a diet can increase the risk, but yeah, high muscle prevents risk. So even with longevity, I'm talking about, man, you're over 60, hang on to as much muscle as you can because there's a whole immune impact involved in muscle. Okay, so muscle tissue means your immune system's going to even be better. But what I'm driving home here in this video is a high-fat diet, these low-carb, these keto diets. Why are they done? One of the main reasons I find is because they start developing insulin resistance and they don't handle carbs well. Okay? They start having a problem with carbs, which it's easy to see because it's causing the problem. And also, it reduces hydration in muscles. Now, you would think, well, reducing hydration in muscle isn't a good thing. I would agree with that. But it does give a vacuum-packed look. So when you take out the carbo fuel, hydrate water, when you take out the carbos of your diet, when you take out those carbohydrates, you reduce the amount of hydration in the muscle cells because for every gram of glucose, you're going to store it with 3 grams of water right inside that cell. Now, fasting also pulls fat from the fat cells. This reduces your body fat, but it overloads the system as well. You're in what's called beta oxidation. You're using mostly fats for fuel. And a lot of people think this is great. Let's get rid of the carbs, big problem. But you get the problem with the carbs because you're not balancing the body correctly. You can't just overload the fats and think this is going to solve the problem. Not to mention that when you do a carb reload, yeah, you're going to gain 5 pounds right away. I mean, 1 potato and you're gaining 2 pounds. That's because that carbohydrate begins to hydrate back and you begin to retain the water. So bottom line, the key with this is that high-fat, low-carb keto diets create low blood sugar. We're going to talk about that next because a lot of people get really confused because they're like, okay, look, I had some elevated blood sugar. I went to see my doctor. I went on a keto diet. My labs have never been better. Well, especially if you're losing weight on the keto diet, I can understand that because you are losing some fat cells. So in some ways, you are reducing fatty acids because you're losing weight. Hooray, I'm happy for that. But at some point, you're going to have to learn how to eat correctly because you're just kicking the can down the road, because the diet that got the weight off may not be the diet that's going to sustain your health long term. So yeah, with a high-fat diet, low-carb diet, you're going to see low blood sugars. You're going to see a low A1C. You're going to see that vacuum pack. You're going to feel like you feel better because you're going to weigh less. You can lose more weight. But a lot of it's going to be water weight. So when fatty acids flood the bloodstream, they do block this insulin receptor site. They damage the muscle cells. And they do prevent your body from metabolizing sugar properly, which is why it sets the stage for insulin resistance, type 2 diabetes, type 3 diabetes, which is Alzheimer's. And you find that you have a problem with carbs. And the reason why you have a problem with carbs is you started out having a problem with fat. So it does start with insulin resistance. A lot of active athletes, they can have a normal A1C because when you are athletic, your muscles will immediately absorb that sugar while you're working out into the muscle. So any sugar in the blood goes directly in the muscle when you're working out. Not to mention that if you're an athlete on a low-carb diet, or you're really watching your carbs, you're not going to have a lot of sugar in the blood. And this is where it gets really interesting, because what it does is it kicks the can down the road. So we're going to look at my patient here, Ted. I have his little in-body machine results here. And we can see we want men to be under 20% body fat. He's 17.8. He's in his late 50s. He feels really good where he's at, and he's watching those carbs because he likes the way he looks in that vacuum packed feel. His body fat's low, his muscle mass is good, his visceral belly fat's down, but it's starting for him. He's kicked the can down the road a little much too often. He's on that low-carb keto diet, and what's happening with his blood work, and we're going to show you an example with the A1C. And let me go and explain what an A1C is first. So this is a test where we can test the amount of sugar in your blood over a 3-month period. So it's like the blood leaves a marking, and we can test it, and we can see over a 3-month average how much sugar was actually in your blood. So this is what your doctor will use to distinguish if you have prediabetes. They're not going to just look at one blood test. They're going to look at the average over 3 months. Now, the way you really know is you do what's called a 2-hour glucose test. And that's where you give somebody a little drink of sugar water, just pure sugar, 75 grams of sugar. And then you take their blood every 30 minutes and you watch what that sugar does. Now, if they're insulin resistant or they're diabetic and you give them sugar water, that sugar is going to go into the system super fast, and it's going to build up outside the muscle, because if you have a lot of receptor sites clogged, we're going to see a lot of sugar in the blood immediately. Okay? And if we test the insulin, we're probably going to see a lot of insulin. So the way you can really test what the body is doing is give somebody a glass of sugar water and then take their blood every 30 minutes. So that's one test that's done, a 2-hour glucose test. And the typical test most doctors will do is an A1C. A 2-hour glucose test, a lot of women will do it when they're pregnant to see if they're diabetic. The doctor will test them in the office. A lot of doctors don't want to do this because you got to sit there for 2 hours, because they're going to take your blood every 30 minutes or every hour to see what the insulin and the sugar is doing, to actually see what that whole process is going on. Now, here's an example of Ted, okay? So he's got an A1C of 5.3. That's totally normal. In fact, that's considered really good for a guy in his 50s, right? So he's got a really good A1C because he doesn't have a lot of sugar in his blood. So when they go to take an average for 3 months, he's not going to show a lot of sugar in his blood. But that doesn't mean that he's not getting insulin resistance. In fact, he's really complaining how in his 50s, he's starting to get a little more belly fat than before. He's finding it's harder to lose weight. This is all signs of insulin resistance. But his A1C is perfectly normal. But we do a 2-hour glucose test, and this is at the bottom here, and we can see for a 1-hour glucose test, he's already pre-diabetic. His A1C is 5.3, but we want his blood sugar under 40. He's 179. Anything over 200 is diabetes. He's really pre-diabetic right here when we did the 2-hour glucose test. Now, the second hour it went down, so he has got the initial onset of insulin resistance. We're never going to know it with his A1C because his diet is not letting us yet see the buildup of the sugar. We're going to have to wait till Ted gets a lot more insulin receptor sites clogged up before that A1C goes up, which is I'm going to show you the next test. In my next test, I show a patient, they're on statins, so we're going to see their cholesterol is low, which can also be a false positive in some ways because there can be other things that cause plaque in the arteries, but the statins are definitely controlling the cholesterol. But if you look over here, they're pre-diabetic. Their A1C is 5.7. That's pre-diabetes. Now, maybe 5 years ago they were down at 5.4, but they're not balancing they're not balancing their diet. They're pre-diabetes, so they're told to exercise, where they're like, okay, I'm already exercising. Well, make sure you restrict the carbs because we see a lot of sugar in your blood, and then logically people are thinking right away, oh, sugar in the blood? Okay, that means I take all the carbs out, right? No, you need to balance the diet. But this is a perfect example of what happens kicking the can down the road. And you can see that the 1-hour glucose test is 184 after an hour. The insulin is really high. So this one, we're showing fasting insulin high. We're showing the 1-hour glucose. All that sugar's in the blood. And that insulin is just getting pumped out. And it's trying desperately to get the sugar in the muscle, but it can't. Because the receptor sites are all clogged. Now, the insulin's going to try. It's going to try super hard. So the insulin, the way it's supposed to work is when it sits on that receptor site, it allows the transport to the surface. The sugar goes into the muscle cell. And when the sugar goes into the muscle cell, it becomes glycogen. It attaches with water. You're hydrated at a cellular level. This is a beautiful thing. But this is not what's happening with insulin resistant. These receptor sites become clogged. First, you start out with maybe 10, 15, 20%. You notice that you don't do as well eating carbs. It's harder to lose weight. All these, your belly fat's getting worse. But the worst part about it is what's going on behind the scenes. You're increasing these ceramides, these fats that aren't so good. And now you do have a problem with metabolizing sugar because the sugar's building in the blood, can't get in the muscle. Now the sugar is going to get into the fat cell, which is going to be located in your midsection. Fat cells are always open for business. So if the sugar doesn't get in the muscle like it's supposed to, don't worry, it'll go right into your fat. So you'll be better at storing fat than you are at burning it. But the worst part about this is that some of these ceramides can be involved in other health implications. Heart disease, kidney, cancers, even adult onset type 1 diabetes. They can affect the pancreas, kill the beta cells. They create the insulin. They're also on their own have been implicated with damaging brain cells. So a lot of people have never really even heard of these before. You can Google them yourself. In this study, I talk right there, it talks about excess fatty acid accumulation in non-adipose tissue and non-fat tissue. It's a hallmark of metabolic diseases. What are metabolic diseases? Type 2 diabetes, type 3 diabetes, which is Alzheimer's, obesity, heart disease. And right here, the study says excess fatty acid accumulation in non-adipose tissue, meaning non-fat tissue, like muscle tissue, the liver, all these other areas that these excess fatty acids accumulate in. So we go on to further studies and we look at the role that is implicated with these ceramides. And this talks about its role with cancers. And it's not just cancers. There's other things as well. I mean, we look at neurodegenerative diseases, Alzheimer's, and how the ceramides are implicated in disrupting neuronal cells. We also know that these ceramides are very arthrogenic. They become plaque, they can create plaque in the arteries. We know that some of the, we know LDL, excess bad cholesterols can do it, but this is another arthrogenic. It's another plaque building fat that, quite honestly, we're not even testing for. Now, I've heard Quest Labs and Mayo Clinic are starting to test for it. In fact, studies show 81% of patients with ceramide risk scores high have an 81% greater risk of a heart attack or stroke. So I think the medical community is starting to realize the implication. But I'm going to just go back and say it one more time, is that it's this excess fatty acids in circulation. And the three areas primarily is going to be from, eating too much fat, having too much body fat, or forcing the release of fatty acids from fat cells. Prolonged fasts, people that are doing high-fat diet with prolonged fasts, because they're so convinced this is how they're going to get lean. And by the way, they may lose some body fat, but it's not sustainable as well. And it's certainly not healthy. So what we want to do, obviously, is we want to understand that protein, fiber, carbohydrates, and fat have a right amount. You have to know realistically what your body needs in these four areas. And what I want to dive in this video, I've dived in other videos, but this may be the first time you've heard about this, so I want to give you all the info in one place. And so how do we come up with how much fat you need? Well, ideally, we know that 25 to 35% of your diet, of your ideal body weight diet, not the diet you're on now. Maybe you're eating a diet and that's why you're too heavy. I'm talking about the diet where you're eating where you need to be at your ideal body weight. So we want to take your ideal body weight and we want to divide it by 3. Now, this is a calculation that I came up with because this is what I do. I work with patients. Really tough for them to look at something and know, am I at 25% or am I at 30? So all food labels are going to have grams of fat. So I just want them to know, get an idea of how much fat you're eating. So if you take your ideal body weight and you divide it by 3, it's going to give you 25%. And you can easily add 20 to 30 grams on that number. So if your ideal body weight is 120 pounds and you divide that by 3, you're going to get 40 grams. You can easily add another 20 to that. So it's going to be like 40 to 60 grams of fat, 25 to 35%. That's going to be a pretty, rough estimation. Well, you can go to one meal and be at 60 grams. But I always say nutritional bankruptcy, you got to know your numbers, folks. You got to know some of these numbers. And when you are looking at your macronutrients, knowing that each one of these play a role in proper health, this video was the hidden dangers of not understanding how the macronutrient fat works in the body. I also want to mention, if you don't know your ideal body weight, I do have a formula here for women. For every inch over 5 feet, add 5 pounds to a 100-pound base. So if you're 5'4", that's 4 inches times 5, that's 20, plus 100, that's 120 pounds. You can easily add 10 pounds to that. So an ideal body weight for someone who's 5'4" is going to be 120 to 130 pounds. For men, it's very similar, except for every inch over 5 feet, you're going to add 6 pounds, and you're going to add it to a base of 106. So that's just because a lot of people sometimes are not really sure what their ideal body weight is, but that's what we're using to get an idea of where these macronutrients. And in this video, I really wanted you guys to have a really good feel for the dietary fats, the good and the bad. I think I went more over into the bad, but the idea that we're so locked into just losing weight, and as long as we're at this low body weight, and we're not even regarding muscle tissue, but it's all about weight loss. Everybody's on these drugs for weight loss, and they can eat whatever they want, and that's really not the ticket, because just because you lose weight doesn't mean you are helping your body from a health perspective. Now, granted, if you lose a lot of weight and you were really overweight, yeah, immediately we're going to get a health benefit. But are you really just kicking the can down the road? To me, I think it's really worth it to understand the significance of how these macronutrients work. And hopefully this video was helpful in understanding the hidden dangers behind too much excess fatty acids. You can get me at myrnamethod.com. I have a membership program there. I work with patients individually as a registered dietitian. I encourage you, if this is interesting or you want to know more, join us, learn more how to eat to be your healthiest and your leanest as well. Sam, do we have any chats?
Oh, not today. But don't forget to like and subscribe.
Oh, don't forget to like and subscribe. Thank you very much, because we are growing, so that means that it's a benefit to some people and they're liking it, so that makes me super excited. All right, Sam, good?
All good.
All right.